Good morning. It's Tuesday, December 7th. Welcome to the Morning Medical Update. I'm Alexis Del Cid. Jess is on assignment today, and we're playing a bit of musical chairs here. We have Dr. Hawkinson next to me on the set. Dr. Stites is at the podium because Dr. Stites has to go to clinic today at 8:20 and save the world, so he's going to make a stealthy exit. In the meantime, thank you for joining us on Facebook and on YouTube. Today, we're talking with area hospital chief medical officers as the number of flu and COVID cases rises in the Kansas City metro. At the same time, we have some health experts predicting the number's going to get higher as we spend more time inside this winter with our friends and our family. So we're going to run down those numbers for you, give you the latest information this morning, and all the best ways you can better protect yourself as we head into the holidays. So make sure get your questions into us on YouTube and Facebook on the Medical News Network. You can also find those links right here on your screen. Good morning, fellas. How are we doing?
As a health system, as a hospital.
In the Roy Kent words, boy.
We're moving along. Dr. Hawkinson, you have our updated numbers this morning.
I'll echo what Dr. Stites said. But 38 active infections with 11 in the ICU and 7 of those on the ventilator, still 22 in that recovery period. So the numbers are creeping up with hospitalizations. And again, I think we talked about this 2, 3, 4 weeks ago when the cases were going up. We said the real bellwether, though, was what the hospitalizations were, and we know those usually lag 2 to 3 weeks behind.
And Hawkeye, we're seeing this nationally. And hey, thanks for switching with me today so I can run the clinic and see a sick patient get put in at 8 o'clock. So that's why I have to run. Hey, you know what? I think what we're seeing is what we were afraid of, right? When the masking mandates went away and the numbers way north of us, say Michigan and Minnesota, were exploding, which they are. Michigan is worse than they've been at any point in the entire pandemic, including when they were well overwhelmed so very early in the pandemic. Colorado's been bad. Kansas, western Kansas has been bad, the Rocky Mountain region. All of that's been converging, and you could watch the heat map just come toward us from both the north and the west. And I think that's exactly what we're seeing now. So as a result, our numbers are rising. But even in the northern reaches of the metropolitan area, things have been going up even faster. So pretty nervous about that. We're going to turn to our chief medical officers in just a moment. The good news is, if we can get through this crisis, some early suggestions, Omicron, maybe it will be more transmissible, but perhaps not as severe. You and I can talk a little bit about that. But also, Pfizer pill getting closer to what we hope will be an FDA approval. 85% effective rate at reducing severe hospitalization and death. That is a grand slam home run if it's true.
Before we start our conversation this morning, we're going to get into depth on this topic with both of our doctors here, but we want to check in with our reporters to see if we have any reporter questions on the line. Anyone out there with a question?
Hi, guys. It's Taylor at 41. Good morning.
Oh. Hey, Taylor.
Good morning, Taylor.
Hi.
Wanted to talk to you guys about this directive from the CDC that people should be doing at-home testing before they go to gatherings. Now, obviously, this time of year, there's going to be lots of gatherings. Just your thoughts on that guidance, best practices, that kind of thing, and how serious people should take that if they intend to go and visit with other people or host somebody, a group of people in their home.
Yeah, I think what the CDC is saying is they're worried. They're seeing the numbers grow nationally, and so they're saying if you go outside your bubble, even if vaccinated, you ought to do a test because you may be asymptomatic and spreading the disease. They're trying to prevent you from doing more spreading throughout the country. There are a couple of problems with that, Hawkeye. First of all, sometimes it's hard to find the test, and second of all, it is a pricey choice for a lot of folks. That is not a cheap test to get.
Yeah, exactly. It's about $12 or $13 per test. Usually 2 tests come in a box for a couple of different of those companies. But also we do understand that there are some false positives and false negatives. Certainly if you are symptomatic and you get tested and it's negative at that at-home test, I would recommend trying to confirm with a PCR as well.
So if you have a family of 4, you have mom and dad, 6 people, you're spending, $75, $100 to decide if you're going to go to somebody's house to hang out. I just, I think if you look at it from a pure medical epidemiological standpoint, I get why they're making that recommendation. I think if we start talking to families and say, is this really what you can afford? I think that's a different conversation. Now, there's some thought that we may get to a point where those testing you'll get reimbursed for, but you'll have to keep the receipts. And that legislation, as far as I know, has not been passed yet.
Did you, just to clarify, so even if you take an at-home test and it's negative, you think people should go ahead and then get another test?
Yeah, if it's negative and you have symptoms and you know that you have been exposed or possibly could have been exposed, I think it's important to understand that, maybe getting a follow-up PCR to confirm that negative test is a reasonable thing. And we've said that, for months now.
Yeah, I kind of think the CDC just put out their Santa Claus wish list, and that was really high. I'm not sure they're going to get that gift under the tree.
Depends on who's been naughty and nice.
Yeah, who's
Whether
been
or
naughty
not
and nice.
they-
And unfortunately,
But- Oh,
COVID's
that
being
Santa
naughty.
doesn't know,
COVID
yeah.
is being
Yeah,
naughty.
but
Yeah.
that is also taking into account, we know that there are other cough and cold viruses going around. We know that influenza now is kind of bursting or surging as well in local communities.
We're seeing a lot of influenza. We're seeing it nationally. There's a large rise, a lot of outbreak on the KU campus in Lawrence. So, the reality is influenza's out there. We were protected last year. Hawkeye, you were telling me some statistics yesterday about the number we're seeing in the U.S. compared to last year, all of last year.
Yeah, and yesterday I had mentioned from September 2020 to March 2021 in our typical influenza season, I think there were like 1,800 cases diagnosed at state and clinical laboratories. However, from October 3rd until November 27th, I believe we've had like 35 or 3,800 cases of influenza diagnosed. So going from 6 months to about 6 or 7 weeks, you can see the discrepancy and the large surge of cases. And the thing with that in the local recent data is that the number of positives is going up every week.
One more thing just to add. If you're sick and you're planning to go to a holiday gathering, even if you're COVID negative, you probably shouldn't go this year.
I would agree.
So if you're sick, stay home, put your mask on. Oh, wait a minute. Have we said that yet? Keep your masks on, people. Whether there's a mask mandate or not, and I know it's an unpopular choice and you feel like, I'm going to look weird when I go out. No, actually, you look like you're trying to show the ultimate holiday gift. You're taking care of everybody. Put your mask on when you go
everybody
outside.
can still go get a flu vaccine and a COVID vaccine at the same time.
And go get your booster.
Yes.
It was probably never a great idea to go anywhere sick, even if it was just a cold.
Yeah.
I mean, the days of people forging through and just going to work and going out anyway, even through a cold, are probably over, right?
Yeah, I may have been always guilty of doing that. There was a
We all
certain day
were.
in the health system when I
Yeah.
worked, and I was a little sick. I went to clinic, and then one of the people in the office I work with turned out to be positive. Well, I should go get it. I was flu positive, and I've been around people all day long. I had a mask on most of the day. I think I had to write for 27%. I was in clinic. I had to write for 27 prescriptions of Tamiflu.
Oh my
So let me
gosh.
just tell you, I'm a bad guy, and I'm guilty about doing dumb stuff. My wife and perhaps the nurse I work with would echo about how much dumb stuff I can do. But at the end of the day, what we've learned in this crisis is that masking and the rules of infection prevention and control, A, keep you safe, B, they travel with you, and C, they will continue to keep you safe for all the days to come.
Do we have any other reporter questions on the line? Let's tailor it. We know we have a lot of viewer questions. In fact, they're already coming in. I'm getting
bet.
tons of questions on Facebook and on YouTube. So viewers, keep those questions coming. We're going to keep Dr. Hawkinson around to answer those later on in our broadcast. And we also have a fantastic panel for you. With the newest COVID-19 variant known as Omicron dominating the headlines, the number of cases in the U.S. is growing daily. And then there's the flu, as Drs. Hawkinson and Stites have been talking about. The CDC says while the number of flu cases is relatively low right now, that unfortunately is starting to rise. Since October 2nd, 2,000 cases of the flu have been reported. Most of those cases are influenza A, and those same numbers show that 80% of the people with the flu are children, young children and adults, young adults ages 5 to 24 years old. So we want to turn to our expert guest now. Joining us from Advent Health is Dr. Lisa Hayes. From University Health, Dr. Mark Steele. From Liberty Memorial Hospital, we have Dr. Raghu Adiga, along with Dr. Davin Turner from Mosaic in St. Joe, plus our own Chief Medical Officer, Dr. Stephen Stites, who again is going to take off at 8:20 because he's in clinic today. He's going to see some patients. So welcome to everyone. Want to start with Dr. Hayes. The number that 80% of flu cases in younger people, is that a surprise for you, or is that normal for this time of year?
And can I just ask each of these
Yes.
CMOs, as they talk, tell us what your number is for COVID in your hospital? Because on our
Oh, good
CMO call
question.
yesterday,
Yeah.
what we are seeing is the most rapid escalation since COVID started in the number of new cases coming in. So, we watch the curves, how fast things escalate, and this is still the Delta variant. We're seeing the most rapid escalation in the curve, and it's more north than south. But we can start with Dr. Hayes, Lisa, and talk to us a little bit about what you guys see influenza, but also talk to us a little bit about what's going on in your hospital with COVID.
Yeah, so in the hospital, we are seeing a rapid rise in our COVID numbers. As of yesterday, we had 31 inpatient active infections, and about 3 weeks ago, we reached a low point of only 12 active infections in the hospital. So we are seeing a dramatic increase over the last couple of weeks. We had 8 infections that had cleared, and in the intensive care unit, we have 4 individuals with active infection, and all of those are intubated, and we have 1 that has cleared infection that's also still in the ICU, still intubated, so obviously very ill still. And only 2 of those 31 individuals have had at least a full series of their vaccination. So again, the overwhelming majority are unvaccinated or not completely vaccinated.
And, I think this again points out that this is the pandemic of the unvaccinated at this point, or if you haven't had it, because we look at our vaccinated numbers, and usually 5 out of 6 or 5 out of 7 are organ transplant recipients. One of my own patients is currently hospitalized like that, had parainfluenza, got here, but also had an exposure just before she came in, and while here converted and has COVID-19 as well as parainfluenza. We checked their COVID antibodies, she doesn't make any. And she only had 2 shots. She had failed to get the 3rd shot. So again, if you're one of those really immunocompromised patients, don't fail to get a 3-shot series, not a 2-shot series, and then get your booster.
That's great. Want to continue our roll call with each hospital system. So we have what's happening at Advent. What about University Health? Dr. Steele, what are you seeing?
Yeah, good morning, everyone. Here at University Health, it's similar to KU and Advent in that we've seen an increase in cases. Currently today, we're sitting at 24 active cases, which is a tripling for us in the past 2 weeks. 12 of those individuals are currently in the ICU, and we have 6 on a ventilator. And 2 weeks ago, we didn't have any patients on ventilator. We also have 9 folks who are recovering. Out of the active cases, 6 are fully vaccinated, so about a quarter. 75% are obviously not vaccinated. We have seen an increase in demand in our call center, not only for testing with more people being symptomatic, but also fortunately, increased demand for vaccines. We also have been running very full here at University Health. We're currently holding 7 patients in our emergency department. And in terms of the flu, last year we did over 5,000 flu cases and had not 1 positive. We've now had a total of 22 positive tests since the day before Thanksgiving. And it really, it's the age range of those positives go from basically the very young to elderly patients. So it's a spectrum that we're seeing in terms of the positivity.
I know it's got to be concerning you. Is your hospital backed up from this? Have you had to think about elective surgeries at all?
Yeah, not yet, but I mean, obviously we're concerned. I mean, we've seen an uptick in terms of holding folks, and I noticed this morning that there are 10 of the area hospitals that are on high volume, which obviously suggests that they're under some pressure and that they are likely holding patients in those emergency departments as well.
Yeah, I think that's an important point. And we started talking about this yesterday. Gosh, are we going to have to do the elective surgery again? That's really hard because a lot of people are trying to get their surgeries in by the end of the year because of insurance. Yeah. And you don't want to have to say no to them, but you have that. You have time-sensitive diagnoses. So I think Dr. Raghu Adiga up in Liberty, I wonder how they're doing.
Hey, good morning. Thanks for having me. Well, here in Liberty, it's really, the numbers are rapidly escalating as Dr. Steele, Dr. Steele is also having the same kind of experience as well as Dr. Hayes. But in the Northland, it's been the most rapid rise that we've seen in a while. Just to give you the numbers, this morning we had 46 and 42 of them are active. And I have little details from the 40 patients that we had yesterday. Just to give you some comparison, a month ago, we had 6. And just a week ago, we had 20. So you can see the rapid increase. Out of those 40 patients, half of them were 65 and older. The other half were with medical problems. And of those, there were 3 patients each in their ages of 20s, 30s, and 40s. And some of them simply just, having BMI of greater than 25 as their risk factor. But the most important thing was, just like Dr. Steele mentioned, a quarter of them were vaccinated. So three-quarter, majority of them were unvaccinated. And of the 11 vaccinated people who had breakthrough infections, 0 had had a booster dose. And in fact, when I looked at details of all of them, 6 out of 11 had J&J, so single shot vaccine. And all but 2 had their last dose of vaccine over 6 months ago. In other words, they were due for their booster and had not gotten it. And there was not a single vaccinated patient on a ventilator. Yesterday, we had 7 in ICU, 3 on ventilators, and again, 0 vaccinated person on the ventilator. And interestingly, more than half of these patients came from Clay County, and Clay County, only 42% of the population is fully vaccinated, and 75% of those 65 and older have been vaccinated. And I looked at their booster dose percentage. Of the eligible people who are supposed to get boosters, only about 11% have gotten the boosters so far. So that goes to tell you, really, it's important. Go get your shot and go get your booster. And maybe you may get to spend your Christmas with your own family than the hospital family. And that's what we're trying our best to do. Yes, we are stressed in terms of bed capacity. Just like what Dr. Steele said, periodically we have overflows in the ED, but we're managing right now. And we do look at, the elective cases, but luckily so far we have not had to cancel any, and it's a day-to-day thing. We continue to look at it. All options are on the table. We don't want to delay anybody's care. We know what happens when we delay the care. So we are not taking it lightly, and we continue to vaccinate. We're working with Liberty School District to vaccinate the school kids, and of course our clinics and hospitalized patients get their COVID vaccine. So overall, we are managing. We just want everybody to continue to help us help them.
So, Dr. Adiga, what was the highest census of COVID you guys have had since the beginning of the pandemic for acutes?
We are very close to it. 48 was our highest, and we are at 46 today, and that was last December. And the highest we had with the Delta was, I think, 45 or so last August. So we are really close to the maximum, and I don't think we are at the peak yet. So I think this will be the highest we've ever seen with COVID.
And you've never had this. I mean, this one comes back to the shape of that curve. When you go up so rapidly, it tells you things are on fire. Like my hair's on fire right now, which is why I don't have any more hair left. So, or maybe something like that.
Yeah.
Before we get to Dr. Turner with Mosaic and St. Joe, I'm curious what the doctors are hearing about when people come in and they haven't gotten their booster or they haven't been fully vaccinated. Are they well enough to explain why? Is it because the booster wasn't accessible to them? Is it because there was a conscious choice not to get the booster?
I think there's still a lot of hesitancy, and I think a lot of the folks who had gotten fully vaccinated are hoping they didn't have to get that booster. And
right.
You know, the CDC, it's only been a few weeks since the CDC announced it for everyone. But unfortunately, the percentage of people, for example, in some of the counties that Dr. Adiga mentioned, even those over 65 are not fully vaccinated. And that's disappointing because we know
right.
across the United States the percentage is much higher than that. It just sets people up for risk. And I think, you know, the vaccine hesitant are still the vaccine hesitant. The problem is COVID isn't hesitant. COVID isn't hesitant. What you have to understand is that this is real. It's deadly. We're seeing it back again, and here we go again. It's like that song, "Here We Go Again." You know, you
Dolly,
don't really want me
your
to sing.
favorite?
Yeah, I
don't
love
play
Dolly.
it again.
Actually,
we don't
Dolly
have the
Parton is
rights
cool.
to that song.
Oh, yeah, that's right. I can't do that.
happened?
I'm curious to see what's going up in St. Joe.
Yeah.
Yeah.
With Dr. Turner, what are you seeing?
Well, thank you. Thanks for having me. Yes, I'm at Mosaic Life Care up in St. Joseph, Missouri. We have been seeing a trend over the last 4 weeks of certainly cases bumping up. We've been running last couple of weeks in the 30s. This past 2 weeks, we jumped up into the 40s to 50s. Today, the hot off the press, we're at 47 COVID patients. That is about half of our max that we saw a year ago, November, December. We actually had 98 COVID patients in isolation at that time, and we had another 32 to 40 that were in the recovery phase. Of those patients, 43 of those are here in St. Joseph. One is in our critical access hospital Albany, up in Albany, and 3 are up in the hospital in Maryville. Of interest in that northwest corner, Maryville has actually been running somewhere between 5 to 10 COVID patients, which even a year ago, that was not the case. We've certainly seen an uptick there. Our watershed is still 100% Delta, although we are vigilant that we do believe Omicron is here. We just haven't seen it yet. Or clearly diagnosed it, but we do believe that that's most likely already in our area just because of travel. What is most disconcerting is when we had 98 patients in our hospital, our positivity rate in our counties that we serve, we have 18 counties in our primary and secondary, but we cover about 35 that'll actually send to us. Our positivity rate was in the low 30s, 30 to 33. Our positivity rate right now for the last 2 weeks is over 27%, which is very discouraging. I'm going to sound like a recorder, with Dr. Hayes, Dr. Steele, Dr. Adiga, just from a standpoint of what we're seeing in the hospital are the unvaccinated. This is a disease of the unvaccinated. About 25% have received at least one vaccine. Many have received 2, but I don't believe any of ours had a booster where they had the 2-week period to develop any antibodies. The other thing we're seeing in these breakthrough infections, these are your over 60, mostly over 80, that 80 and up range. We're seeing acquired disease, even though they've been vaccinated, they have not received their booster. They really need to do that. And our immunocompromised, our cancer patients, any of our organ transplant patients, we would normally have go on down to KU because that's where most of them had received their care. So that's really where we're at. From an ICU perspective, we have 5 people in our ICU. 4 of those are vented, and we do have about 12 in the recovery phase. And I like that term, but what that means in our world is that means you've been in the hospital for over 21 days, and you are just having a very long hospitalized course. And that is also discouraging, especially if you are at extremes of age, because those folks just don't seem to do very well. We do have a low vaccination rate overall in the 18 counties that we serve. From a booster perspective, I think people are just fatigued, and it's not that it's not been available. We've had some mass vaccination events, and we did get a lot of folks to come in, but overall percentage-wise, it's extremely low. And that would be the key is wear your mask, wash your hands. I get a lot of criticism for saying wear your mask, but wash your hands, wear your mask, and get your booster. They're available, and we certainly make them available. And if there's an outcry, for more, we will have more mass vaccination events in our area to support those folks. From a flu perspective, we had 8 cases last week. That matched our total number of a year ago. We're a little over 30 right now. And last week we had over 655 positive COVID tests in 1 week. That was up from about 355 the week before. So we had doubled. That matches almost our high a year ago, November. We had 695 positive tests in ending the week of November 20th last year.
So Alexis, I'm going to have to run, but I just want to say thanks to all our chief medical officers for being part of this. It's so important that the entire region hears your voice and hears all the collective voices about what we're going on. The reality is this. This is not a lie. This is not a conspiracy. This is not a big steal. This is not fake news. At some point, we got to wake up and see this the what it is. This is something that can really harm you, and the only way to stay safe, get yourself vaccinated, wear your mask, and just be careful out there. We've bent the curve before. We've done it 3 other times. We're going to have to take the same measures to bend this curve again, or these things that are beginning to fill up our hospitals, these cases, are going to blunt our ability to take care of you if you have a stroke, if you have a heart attack, if you break your arm or break your hip, because we won't have beds. We had 25 people this weekend waiting for beds in our emergency room. That's a problem, folks, and we have to get a hold of it. And what we really have to do is just trust the science, and you can solve it. We don't have to be like this. We can be just fine through the holidays, but it's going to take the action of each and every one of us. And with that pleasant reminder, I am going to go upstairs, and Hawkeye's going to cheer. Thank you.
Dr. Stites is going to clinic. Dr. Hawkinson and
Be
I are going to
here.
hold down the fort. We do have tons of community questions, Dr. Hawkinson, so we're going to get to those community questions as well for you and our other chief medical officers around the area. We're getting a lot of questions about the flu, and I wanted to go back to Dr. Hayes because we were asking you initially from Advent Health, is it typical to see the percentages you're seeing, 80% of the flu cases in younger people right now? And doctors, you can all weigh in. And also, John Mayers would like to know, what's the mortality rate of the flu? We'll start with Dr. Hayes.
Well, I have to say we haven't seen much flu inpatient yet here. I get a daily report of our isolation cases, including influenza, and I haven't observed any. I know we've had some anecdotal positive tests through our outpatient laboratory. I think that number that you're quoting as far as the number of people in that age range who are coming down with the flu is kind of indicative of the fact that that is an age range that tends not to get vaccinated, that should be vaccinated. Older individuals make more of a point of going to the doctor every year to get their flu vaccine, and those younger individuals tend not to go to the doctor until they're sick. And by then it's too late to get the flu vaccine. So I would say, just want to encourage everyone to be getting the flu vaccine now while you're healthy to be preventing influenza.
Want to go back to a community question that involves something that Dr. Hawkinson, you had said at the start of the broadcast. Is a false positive PCR common or uncommon? This is from Lindsay Heron Anthony.
Yeah, for the PCR tests, again, those are very specific, picking up the genomic material of the virus. So that is more sensitive, more specific. We don't really see, if you have a positive on the PCR test, you need to treat that as a positive test.
Question from Mary Deal, and I'll ask Dr. Steele this question from University Health. COVID appears to be on the run. I have 3 family members with it. How do you know what variant you have? Is there a test for different variants?
Well, there's obviously the ability to do sequencing in certain centers. And of course, that's ongoing across the country. I think they're actually trying to sequence about 80,000 of the positive tests weekly. And so, but what we know is that 99.9% of the variants that are out there right now are the Delta variant. So I think it's safe to assume that these individuals are infected with Delta.
Mm-hmm.
Question for, well, Dr. Hawkinson, I'll ask you this question. Several of our viewers are asking if the hospital is bracing for some sort of a surge and what the hospital systems are doing differently to brace as we head into flu season as well.
Yeah, I mean, I think all our colleagues here on the show today are. We are always prepared, bracing, always ready for that increased capacity for whatever may occur. Certainly now we are concerned about COVID-19, but also influenza. And again, we haven't seen a lot of hospitalized influenza, thankfully, but we are always concerned that that could happen. And also, we don't exactly know what is going to be the large umbrella outcomes and clinical changes in those people that have both influenza and COVID-19 at the same time as well. So overall, yes, the hospital system, the hospital here, all the hospitals around the area are preparing for increase in hospitalizations due to COVID-19, but also influenza should that occur. But again, we've heard Dr. Stites talk about this. You know, at any one point in time when we were just dealing with influenza, there would be, maybe 2 or 3 cases in the ICU, maybe several more scattered throughout the hospital at any one time for influenza. So we didn't ever see a large amount of people hospitalized with influenza. Certainly, older age would confer more risk to be hospitalized, but I'd be interested to see what our colleagues are saying. But yes, we are always ready. We are always prepared should that surge occur.
We've got a couple of vaccine questions when it comes to the COVID vaccine, and they piggyback on top of each other, these questions. Ruthie wants to know, when you say fully vaccinated, does fully vaccinated now mean you've also gotten that third booster shot or second if you've had the J&J? And then Patty wants to confirm that it has to be 6 months, the booster shot, after the second vaccine. Would it hurt anything to get boosted? Let's just say if someone only waits 5 months or 4 months. And let's go to Dr. Adiga for that answer first. We haven't heard from you in a couple questions.
Yeah, well, for all practical purposes, as Dr. I think Steele or somebody mentioned earlier, the fully vaccinated now means having the 3 shots if you're using the mRNA vaccine. So you get the 2 initial shots and the 3rd shot 6 months after the 2nd shot. If you're talking about J&J, it's 2 shots, taking the 2nd shot 2 months after the 1st shot. And then 2 weeks after your last shot is when you're fully protected. So the CDC has not officially changed the definition of what it means to be fully vaccinated, but for all practical purposes, we physicians consider this to be the fully vaccinated state. And as to the question of would it hurt to take it a little earlier? Well, most of the studies done so far indicate that the best chance for your immune response is after this length of interval, 6 months after your second shot. But having said that, there are a few people who are immunocompromised who may have gotten it a little bit earlier. But for general population, I would recommend waiting for 6 months from the second.
Mm-hmm.
Ruth Allen has a question. This is a question, I think we've all been getting this from friends, family, loved ones. How do you know the difference, and I'll go to Dr. Hawkinson for this, how do you know the difference between the flu and COVID? At what point do you make sure you go get tested, go to the ER? How do you know once you're at the doctor's office?
Yeah, it's really difficult to know that because a lot of the symptoms are similar. High fever, you can have aches. Certainly you can maybe tease out granular details about symptoms, but right now in this time period, I don't think you can ever be sure until you go get tested. And luckily, some places are having a molecular test, a PCR test, that includes flu A, flu B, RSV, and COVID-19 as well. So unfortunately, you can never really be sure. And again, we know that there are those seasonal cough and cold viruses, whether they are the typical coronaviruses that we know about, rhinovirus, parainfluenza virus. We know that there are other cold viruses going around, and unfortunately you can't know unless you take that test, really to help rule out influenza, RSV, and COVID-19 as well.
Barbara Luby has a question, and this is about the J&J shot. Barbara wants to know, what is the proper booster shot for J&J? Common question of people who've gotten the J&J vaccine. Let's go to Dr. Turner at Mosaic in St. Joe.
Right now with J&J, we recommend that you get a second J&J. I believe Dr. Adiga even spoke to that. A couple of months after your first shot, we recommend you get the second one. And then you would be fully boosted. When it comes to the mRNA vaccines, they have said that even if you had Pfizer initially, you could get a Moderna, or if you had Moderna initially, you could get a Pfizer. Initially, they said they wanted you to have a series of all 3, and I think most of us would say that's the one we would recommend you stick with. However, they have withdrawn that and said that you can have either one for your booster vaccine or for that third vaccine, and that counts.
I can add to that, Dr. Turner. People who have gotten the J&J can certainly get the mRNA vaccines for their booster as well, 2 months after the initial J&J. And in fact, there is some data to show that may be actually better than the J&J itself.
Dr. Hawkinson, you're nodding.
I would agree with Dr. Adiga, too. I think a lot of expert opinion has moved towards endorsing maybe getting that mRNA platform vaccine after J&J's.
Mary Verhulst would like to know, do you think the timing of the current case increases of COVID have something to do with Thanksgiving get-togethers? Dr. Hawkinson?
Yeah, I think it's a combination of all these behaviors. It's reduction in those mitigation strategies and those restrictions. It is the cold weather. It is also the gathering during holiday times and just people getting back together. So I think there are a lot of behavioral details that would help and have helped increase the case surge. And now 2, 3, 4 weeks after the cases were increasing, the hospitalizations.
Kelly Shepard Smith has a question she'd like. I think she'd like all the docs to weigh in on this if you have feelings on this. Could you address why areas of our country are at their worst that they've been during the entire pandemic, why certain areas are, yet we have vaccines available? We've touched on this. Is there one answer to this? Is it vaccine
I think with
hesitancy?
COVID-19, and we'll certainly get our guests' answers, it is always multifactorial. It's not just one thing. But what we have seen, and it has been consistent now since the new Delta surge and the rollout of the vaccines, is that this does continue to be more of two pandemics, one of the vaccinated and one of the unvaccinated. And so, yes, we do have vaccines, but also the problem is we have such a supply of vaccines because we know that there are a number and a lot of people in certain geographic areas spread throughout the country who are not getting vaccine doses or boosters, not even getting their first vaccine. And so that's a problem, and I would certainly want our guests to weigh in on that as well.
Sally Jercha would like to know if the doctors would like to see schools go back to masking. Dr. Hayes, what's your professional wish on that?
I would love to see the schools go back to masking and enforcing masking in the schools. My spies on the inside, my own kids tell me that a lot of times kids were not even wearing their mask correctly. We know that masking helps prevent infection, not only with COVID, but with influenza and all these other seasonal respiratory viruses that Dr. Hawkinson was talking about. So yes, I would like to see masking be recommended again.
Donna Winokur has a specific question for Dr. Turner. Donna writes, it's great to hear from Mosaic. How can I go about getting a vaccination there? I've had to miss the last large event at the mall.
Okay. If you've missed that event, what we can do is we do have clinics that are providing the vaccine several days during the week. There's a clinic out at North Point, which is out near the shops at the Northland. You can call there to arrange to get a vaccine, and the other clinics are also providing them. I believe our specialist of internal medicine are providing them, and then we also have pediatric and adult medicine. And certainly if you're having issues, call the hospital and ask for me, and I will make sure we arrange to get you a vaccine. We want to get everyone vaccinated who wants to have the vaccine.
Well, that's great service. Just ask for the CMO and they'll get you in. That's a wonderful answer, Dr. Turner. Isaac has a question, and I think it's a long question, but at the end I think he gets to a point that we're all at. He writes, are the vaccines having an effect on the hospital census? I know the numbers are going up, but thus far it's a lot lower than what I remember from last year at this time. Is this a genuine effect, or is it held lower because of more non-COVID patients? And then this is the part I think we can all relate to. Isaac writes, I just want a shred of good news that I can hang on to right now. I want something to be happy about. I want to know there's hope for the future. Dr. Hawkinson, can you give Isaac hope for the future? I mean, I think he asked that for all of us.
Yeah, I think there is. We have to have hope, and we know that the way in moving through this is understanding the science, really paying heed to what that shows us and tells us, and it gives us the ability to stay healthy. And what that means is continuing to be able to work and keep places of business open. Again, because we've said this before, a healthier nation always has more production, has better quality of life, but we know the way to do that. Certainly, vaccinations are going to help with that, help us get through as we can day by day and really try to get back to normal, but also to finding some new set of normal in living with the virus.
I have a specific question from Kim Moore. I'm going to send this one to Dr. Steele. Kim Moore Bosley would like to know if you are living with cancer Is there a specific vaccine that doctors recommend if you have cancer? Is there a specific booster or combination that you recommend?
Yeah, not to my knowledge. I don't think there's a specific recommendation other than to absolutely get vaccinated. And if it's appropriate for you to get a booster or the time is right, you want to get the booster as well. And of course, I mean, depending on the type of cancer it is, we already know that at least with the mRNA vaccines that you want to get those first 2 initial doses, and then an additional dose was called for people who have certain types of cancer. So certainly you want to consult with your physician and get their recommendation about what they think might be best.
When it comes to paying for COVID testing, Dr. Hawkinson, we talked about this with Dr. Stites. That can get really expensive. Angela Inkst Saylor would like to know, well, she said, I thought the government was going to make insurance companies pay for COVID testing. Dr. Adiga, what have you heard about that, and what are you telling your patients when they come in and say they don't want to pay for a COVID test?
Yes, the COVID tests that we usually run, the PCR tests that are done at the hospitals and facilities, they are typically covered by the insurances. Most of those are being done for a purpose, typically symptoms or exposure or pre-procedure testing. They're all typically covered. The question of doing the testing before a gathering, that I'm not sure we'll be able to get that covered by the insurance. That's what I think Dr. Stites was talking about, how expensive it can get in those kind of circumstances.
When it comes to booster doses, we know that booster doses are being recommended for everyone eventually. Jennifer Rhodes would like to know, when do you expect booster doses for 16 and 17-year-olds, some who've gone for more than 7 months since they got that second shot? And are they at risk having not gotten their booster shots yet?
Yeah, and I think
Hawkinson?
this goes back to the question of, do I need to get a booster dose before 6 months? Really, the data would not support that. You are still very well protected even after that 6 to 8 months. What we hope to do by giving that booster dose is to help maybe reduce transmission rates, really build up those neutralizing antibodies so that you can protect against further transmission. So I think that also allowing that further time to elapse, that 6 to 8 months, you are allowing your immune response to further evolve, and then you get that boost from the booster. I think, and Dr. Adiga could weigh in too, I think we are going to be moving towards anybody who is 12 and above first, because we know that the initial vaccine EUA was for those 12 and above, to be able to get that booster dose at any point. Obviously, last week, I think the CDC just moved to anybody 18 and over can now get a vaccine boost. We know, and so I feel that we are moving towards anybody 12 to 18 is soon going to be able to do it as well, and see what Dr. Adiga has to say too.
We've had a lot of questions from people wondering if they're going to need to get a booster shot after their booster. Like every 6 months, are they going to need to boost themselves again? Because we know that a portion of the population got their booster shots in August. Dr. Hayes, does that mean that people are going to need to get a 4th shot in March or February?
That's the wonderful thing about science is we're going to study how infection rates respond in the next 6 months and next year, and we'll decide based on the evidence whether we are seeing breakthrough cases and whether we need to get boosters. So time will tell. We'll continue to follow the evidence and the science and determine whether or not we need to.
When it comes to Omicron, there have been reports, Dr. Hawkinson, that Omicron has been in the U.S. longer than originally thought. This is from Ashley Hand. Ashley says, she writes, wouldn't we know by now if it's more contagious or severe? Is this just the expected surge around the holidays when it gets cold?
Delta predominated so much in every state, in every community, really. I don't know that we really have evidence yet that it was here before we first identified it. But I think that is the big issue is Omicron going to be able to outcompete Delta for predominance in any specific geographic region? So, that question is not fully answered, but I think we are still trying to learn about that. But overall, not only here, but also in Europe and other places, we know that Delta continues to be the main driver of that. And I think that is more of a function of more people have Delta, more people are in those at-risk situations where they're indoors with a lot of people. And so just by those pure behaviors, you're going to be having Delta spread more. But I think we will see in the next coming weeks, maybe a couple months, to see really how Omicron and Delta really kind of duel out this setup for competition to see if one can outcompete or one is more fit than the other.
Vicki Logan has a specific question for Dr. Hayes about the vaccine requirement. Vicki writes, could you ask the Advent doctor why they retracted their employee mandate for vaccinations? Dr. Hayes?
Yes, so before the stay was enacted on the CMS mandate, we were moving forward with a vaccine mandate. And then with the recent stay from the federal courts on the CMS mandate, we have paused the mandate and processing exemptions. However, we continue to encourage all of our employees and of all of our patients to be vaccinated, and happily to report that we have 87% of our employees who are vaccinated currently.
Question about flu shots. Man, we're getting the questions fast and furious this morning. This one comes from Adele Nail. Adele would like to know which flu viruses are covered in the flu shot this year. Yeah. Dr. Steele, we haven't heard from you in a while, but Dr. Hawkinson, you were piping up there. Did you have something you wanted to?
No, we'll see.
Dr. Steele?
Well, I actually may yield to one of my infectious disease colleagues to answer that. So, yeah, the specifics of what's covered.
Dr. Hawk?
Yeah, so it is two. So now I think all of the flu vaccines have moved to quadrivalent, meaning that there are 4 strains in the flu vaccine. There are 2 A strains. One is a 2009 pandemic-like strain when that H1 strain was out. There's also an H3N2 strain, which is the predominant strain right now of what we are seeing in those clinical and public health laboratories. And then there are 2 B strains as well. So right now, again, it looks like the circulating most popular or more predominant strain is that Influenza A H3 strain. There is a very little amount of activity of the Influenza B. So that is what the vaccine contains. It's 2 A's and 2 B's.
Dr. Adiga, we have another question about the flu. This one comes from Mike Parker. Mike would like to know, would the cases of influenza be higher in areas where masking is less prevalent, or should we expect to see less flu in areas where there's more masking?
Yeah, I mean, this seems fairly obvious. Time will tell. I mean, last year we had virtually no flu because of the masking. So similarly here, this year, given that the masks have gone away from public places now, we do anticipate there's going to be a higher flu in areas where there is no masking going on at all, especially indoor masking. So that's what's expected, and time will tell.
Maggie has a question. She writes, I've had the 3rd shot for immune compromised. Do I also need the booster? By the way, I got the Pfizer vaccine. So she's had 3 shots and she wants to know if she should get a 4th shot?
Yeah, I think the simple answer is yes. I would recommend that. If it's within that or out, in that time frame where you are okay to go ahead and get that. And I still believe for the 4th dose for immune suppressed, it's 6 months from that 3rd dose as well.
Are the booster shots free? Ross Hill wants to know, is the J&J booster shot free? The first one was. I haven't heard of any. I've heard most people are able to go and just get their shot.
Yeah, all vaccine shots are free.
Yeah. All vaccine shots are free. Dr. Adiga, is that what you said? I stepped on your answer a little bit. Okay. And then I've got questions. Oh boy, got a long one from Sal Fish. How have cases in children been impacted by the introduction of the pediatric vaccine, like reduced infection rates even after exposure to a positive case? My girls will be 2 weeks past their 2nd dose next Monday, and we want to get together unmasked with the family and friends over the holidays. Is it safe for Sal Fish to get together unmasked with his his kids? Who wants to take that one first? I think I can read what you're going to say.
I'll follow up, Annie.
Let's check in with either Dr. Steele or Dr. Turner. We haven't heard from either of you in a couple of questions.
Yeah,
Dr.
if I
Steele,
understood
you go
correctly.
first. Okay.
Yeah, no, I think if they're 2 weeks beyond their second dose and they're considered fully vaccinated, I think the entire family is. I think they certainly can gather safely unmasked.
Okay. Brianna would like to know, she's going to a wedding this weekend. Is that safe? Mm-hmm. I'd like all of you to, what would you tell people who are going to a wedding or a big event? Dr. Turner, let's have you first.
Okay. I think that, as we said earlier, one, if you're going to be going to a big event and you can get testing at your local pharmacy or wherever, go pick up a test and test yourself. Even though it's not 100%, it is going to certainly give you some reassurance. If you're symptomatic in any way, shape, or form with any type of viral illness, it would be recommended that you not go. You don't know, is it COVID? Is it influenza? Is it the common cold? So, is it safe to go? If you're asymptomatic, we would recommend that you go ahead and test yourself, whether you've been vaccinated fully or not, to give yourself some reassurance. That would be my recommendation. I certainly defer to any of my other colleagues as to what they would say in regards to that.
I'll weigh in. I think it really depends on also how well you feel comfortable among that group. Do you trust that group is also vaccinated in the majority, and you're going to have some type of herd immunity as well, and be protected in that way? Definitely making sure that you yourself are vaccinated, and as you said, making sure that you're negative before you go and not having any symptoms. But if I trust that the large group, the majority are vaccinated, then I'm going to feel more comfortable going myself.
Okay.
I might just add in that also depending on what the event space is like and what the airflow is, how big it is, how much you have the ability to socially distance. I think those all sort of weigh in. How big is the group, and obviously to the extent that you can feel confident that the vast majority are vaccinated, that would be helpful. Otherwise, I mean, you'd want to be thinking about either not attending or wearing a mask. I would recommend.
I want to let all our viewers know we're getting your questions. We're almost out of time. We've got time for just one or two more, but we're going to save the questions that we haven't been able to ask today, and we will save them for another day. So keep watching and keep sending your questions in. I've got one more from Ashley Hand. I'm 45, healthy, fully vaccinated as of March of 2021, and recovered from a moderate case of COVID in December of 2020. How urgent is it for me to get a booster? So she's had 2 shots. She's recovered from COVID. Ashley wants to know if she needs to get a booster as well. Dr. Hawkinson.
I would say, yeah. I mean, what we do know, and this is just people who were infected and then vaccinated, not necessarily vaccinated, infected, and then vaccinated. But we do know that those people that have had infection do develop a more robust or hybrid immunity. And plus, we see that if you are that far out, as we talked about earlier in the show, you've had time for that immune response to further evolve. Now, when you get the vaccine dose, those specific T cells, B cells are going to expand even more to provide you that protection. So I think now would be a good time to get it.
We're going to have to wrap things up because we're running out of time. However, again, keep those questions coming. We will get to them eventually. There's also a really important topic that we want to tackle this morning, and that's supply shortages. They're not only an issue here in the Kansas City metro, there is a huge need for blood donations across the state. The Community Blood Center says its blood supply stands at a 1 to 2 day inventory. Only 1 to 2 days. That's well below the ideal 7-day supply that they really need to have on hand. So there are 2 ways you can set up an appointment to donate if you're eligible to donate. You can schedule appointments by calling this number. Grab your pencil. It's 877-468-6844, or you can visit savealifenow.org. Always important to donate if you can donate. Want to get our final thoughts. So let's start with a whip around of our final thoughts today. Dr. Hayes, final thoughts.
Final thoughts. Number one, get vaccinated, get a booster if you're due for a booster. Stay safe, and wear a mask when you're out in public.
Dr. Adiga?
Well, it's a broken record. We've done this before. We know how to do it. We've done it 3 times, and fourth might be the charm. Please do it. And as Dr. Hayes said, get vaccinated, wear masks when you're indoors. We can do it. We'll get through it, certainly. And wish everybody happy holidays.
Dr. Steele, final thoughts.
Yeah, pretty much the same message. Obviously, if you're not vaccinated, this is a good time to get vaccinated. If you're due for a booster, please get your booster. And also, it's not too late to get your flu shot. And you can obviously get your COVID booster or initial vaccination along with your flu shot at the same time if you desire. And we have at both of our centers, we have walk-ins. We take walk-ins for boosters and initial vaccination. We prefer that you call our 404 care line to make an appointment, but we certainly have availability if people are looking to get their vaccine or booster.
And Dr. Turner, finally, with our panel. Dr. Turner.
Completely agree. Vaccination is your primary means of avoiding severe illness or illness at all with this disease. But I do want to leave the one caller that wants hope. Where is some hope with this? And I believe that the development of more and more medications to treat this. When we started treating COVID, we had nothing in the armamentarium other than oxygen, supportive care, and wonderful care by all the nurses, the folks cleaning the rooms, the folks bringing the meals. That's all we had. Now we have monoclonal antibody that we can infuse. If you do have contact or you become ill early on, we have treatments that we can give you when you're in the hospital. Are they 100% effective? Not completely, but they are far better than anything we have. We have a oral medication that I expect will get approval very soon to use in the outpatient setting. However, vaccine is your primary means of protecting yourself. Get fully vaccinated.
Dr. Hawkinson, Dr. Turner makes a great point of how far we've come in 19 months.
Yeah, absolutely. And I would echo his and other guests' statement. There is still time to gain immunity towards influenza. Please go get vaccinated. Get your first dose or your booster dose of vaccine for COVID-19 at the same time. We know that there is a COVID-19 risk assessment for people that are going to gatherings. There is a website produced by Georgia Tech. And right now, if you're looking at Johnson County, Kansas, and you're wanting to gather, if you have 50 people at that gathering, you have to assume at least one of those people is positive. And so I think that's important to understand. You can use this tool, but the best thing is to go get vaccinated. You still have time to create that immunity, whether it's to influenza or COVID-19. And we will keep up with you as we move further into the holiday season and people asking questions about gathering and doing those things. But also the important thing to remember is if you are planning to do something with family or close friends for Christmas time, you can always just elect not to go out and try to self-quarantine yourself 10 or 14 days prior to that so you can help reduce your risk of exposure to SARS-CoV-2 as well.
Thank you so much for being with us today to our expert panel. It has been great to get this broad view of what's happening. And remember, you can join us anytime in any of our live broadcasts on our Facebook page or on our YouTube channel. Thank you for watching and bringing your questions to us. Coming up tomorrow morning, his work is credited with helping create a number of the COVID-19 vaccines we have today. So how did one of our popular guests and Deputy Director of the National Institutes of Health do it? We're going to go more in depth as we talk with Dr. Barney Graham tomorrow morning. We'll see you back right here at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.